Hey everyone, this is part 3 of the previous videos, routes of administration of drug. The systemic route is divided into enteral and parenteral. We've already discussed the enteral route. Now this time the parenteral route. The word parenteral means beside GIT, as par means beside and enteral means GIT. It is further subdivided into the intramuscular, intravenous, subcutaneous, and intradermal routes. So parenteral routes are used for drugs that are poorly absorbed from GIT and for agents that are unstable in GIT. First, let us look at the subcutaneous route. Here, a small amount of drug is injected into the subcutaneous tissue, which is richly supplied by nerves. Absorption is slow, so action is prolonged. So this method is particularly useful when continuous presence of drug in the tissue is needed over a long period of time. Example, insulin. Advantages of subcutaneous route: suitable for slow-release drugs, ideal for poorly soluble suspensions. Next, disadvantages: irritant drugs can be used, large volumes also cannot be used. Subcutaneous routes can be further subdivided into dermojet, palate implantation, and non-biodegradable and biodegradable implants. Dermojet is a high-pressure injection therapy in which needle is not used. Here, a high-velocity jet of drug solution is projected from a microfile orifice using a gun-like implements. The solution then passes through the superficial layer and gets deposited in the subcutaneous tissue. It is a painless method and is easy to use. Example, anesthetics. Next, pellet implantation. The drug is placed into solid pellets and introduced into the subcutaneous layer through trocar cannula, which is the type of instrument. So here, drug can be sustained over weeks or months. Example, testosterone. Next is non-biodegradable and biodegradable implants. Cialistic is another word for non-biodegradable implant. Both of them are placed in the same manner, that is, crystalline drug is placed in tablets or capsules made of suitable materials and implanted under the skin. Slow and confirmed release of drug takes place over months, providing constant drug level. So here, the non-biodegradable implant has to be removed, whereas the biodegradable one we do not need to remove. Example, hormones and contraceptives. Now let us move on to the intramuscular route. Here, the drug is injected into one of the large skeleton muscles like deltoid, triceps, gluteus maximus, which is the largest and heaviest muscle in the body. Example is diazepam phenytoin. Advantages: first pass is avoided, and also gastric degradation is also avoided. It is less painful and action will be rapid and is suitable for oily vehicle and irritant drugs. The disadvantages are only up to 10 ml drug can be given. It is expensive, may cause neurovascular damage. Self-administration is difficult. Now the third route which comes under the parenteral route is intravenous, which is the most common parenteral route. The drug is injected as a bolus or infused slowly over hours in one of the superficial vein. So infusion in the form of drips. Example, dextrose, normal saline, oxytocin. The advantages are there will be rapid action and bioavailability is 100%. Large volume can be infused. Irritant drug can also be administered. It is useful in vomiting unconscious patients. They do not get affected by gastric juice and first pass metabolism. Disadvantages: once injected, they can be withdrawn. Self-medication is difficult and it is less safe and painful. There is danger of infection. So strict aseptic conditions should be maintained. And the last one is intradermal route. Here, the method is totally painful. This route is employed for a specific purpose only. The drug is given within skin layers, that is dermis. It is mainly used for testing sensitivity of drugs. For example, penicillin, ATS, anti-tetanus serum. Let's move on to cutaneous routes, which is the third classification in the systemic routes. Here we use transdermal patches. Well, the rate of absorption here depends on the physical characteristic of skin, the site of application, and lipid solubility of drug. This route is most often used for sustained delivery of drugs. For example, nitroglycerin, used for angina pectoris. Scopolamine, which is an antiemetic. The advantages of this route are: there is no effect of first pass in gastric juice. It is convenient and painless. It provides sustained release. The disadvantages are: some patients are allergic to patches and may become irritant. The drug must be lipophilic. Now let's move on to the next systemic route, that is the inhalation route. The alveolar epithelium offers good surface areas, especially for lipid-soluble drugs for rapid absorption. Here, the administration should be continuous. If the administration is discontinuous, the drug will diffuse back and is rapidly eliminated in expired air. So, controlled administration with moment-to-moment adjustment is possible. Example, general anesthetic. Generally, volatile liquids and gases are given by inhalation for systemic action, whereas non-volatile drugs can also be administered by inhalation for local action in respiratory tract. For this, the drugs should be in the form of fine mist or aerosol, for example, salbutamol, beclomethasone inhaler for asthma. The advantages of the inhalation routes are rapid action. There is less side effect. Less dose is required when compared with the oral routes. It is effective for patients with respiratory problems. The disadvantages: the proper training is needed for correct use of inhalers. Not useful during acute attacks because airway get constricted. Now the last route under the systemic is nasal route. In this, the administration of drug is directly into the nose. The mucous membrane of nose can readily absorb many drugs. The lateral walls of nasal cavity contain highly vascularized tissues. Drugs like desmopressin is applied as spray, or nebulized solution have been used. Nebulized means converted to a fine spray. The advantages of the nasal route are: again, there is no effect of first pass in gastric juice. It is convenient and painless. Rapid onset of action is possible. Self-administration is possible. It is ideal for drugs that are lipophilic. The disadvantages are: only limited volume can be used. Frequent use may cause harmful effect on nasal epithelium. Like this, we have come to an end of the topic, the routes of administration of drugs. You can check out the previous videos to understand the local and the enteral route.